Functional Health Patterns Assessment, Guadalupe, Arizona. Introduction. Guadalupe is a town in Arizona that has a long and captivating history. Though it was incorporated only in 1975, its foundation was dated by Yaqui Native Americans earlier, in 1907. This Native American and Hispanic community has its peculiarities and interests. This is why the analysis of this community should be rather educative and exciting. Information on the community of the town of Guadalupe, Arizona, was frequently obtained from the internet, and such choice makes it possible to check this information's reliability and appropriateness to the topic. The main purpose of this paper is to perform a thorough analysis using which community's concerns, strengths, and weaknesses may be identified and evaluated. FHP Assessment. Health perception concerns are based on annual checkups. Immunization is about 90%, birth rates are about 35.2%, death rates are about 600.4 per 100,000, and morbidity is at 2.4 for ages 65 to 74. Risk factors are connected to a low level of prevention programs that may improve human mental and physical health. The strengths of this concern are connected to the constant improvement of helpful programs that aim at controlling regular exercises people have to complete. Nutritional, metabolic concerns are all about weight and height conditions, the use of diets by the residents, promotion of healthy eating, childhood obesity, food stamp recipients are 1,405 of 5,000, and lack of exercises and legislative processes. The strengths of the community are presented in the form of the development of physical exercises and the community's access to such exercises. Elimination concerns are based on outside factors of the chosen area, high levels of toxins production, implementation of automobiles in each industry, and the presence of live music that promotes good mood and happiness. Strengths of this concept are connected to the style of life preferred by this community, prohibition of too loud noises after 10 p.m., respect for each member of the community, and governmental support available to people. Activity, exercise concerns are dependent on the style of life supported by the community, lack of activities to promote proper human health conditions, absence of public transportation that is available to all residents, and crime growth within the community. Strengths of this concern are represented using law enforcement services and the 24/7 duties of police officers. Cognitive, perceptual concerns, language challenge, limitation of educational programs, and poor library access. Strengths exist in the form of developing proper school reforms and systems according to which students can reach the necessary place, gain knowledge, and save time. Sleep, rest concerns, sleep disorders like insomnia inherent to Native Americans and sleep apnea inherent to Latinos and inability to provide proper conditions for sleeping. Strengths, governmental noise control, residents' respect for each other, and the creation necessary medical drugs to prevent sleeping disorders. Self-perception concerns, differences of ethical backgrounds, residents' pride, and variety of levels within the healthcare system. Strengths, attention to ethical inequality and improvement of the healthcare system. Role, relationship concerns, the proper development of the relationships within a family, duties division, and governmental control. Strengths, friendly relations with each other, respect for each member of the community, attention to community members' demands and interests. Sexuality, reproductive concerns, death average age is 86.4, foodborne diseases are at 6, and information on mental health is still not available. Strengths, attention to death causes, prevention of mental illnesses by developing medical equipment, and promotion of a healthy style of life. Coping and stress tolerance concerns, progressive poverty within the community, population growth, and drug abuse. Strengths, improvement of mental health hospitals, development of drugs, and alcohol prevention programs. Value, belief concern, different religious beliefs, Catholic and Christian faiths, respect for prayers, and those people who can heal. Strengths, the presence of organizations that support human religious choices and interests, a human strong belief in spiritual power, and respect for each other's beliefs. Cluster clue and nursing diagnosis. Among the variety of cluster clues, it is possible to define the one that unites abnormal data and the chosen community strengths and is connected to services that are available and unavailable for the town of Guadalupe, Arizona, community. Challenges people face in the transportation field. Inability to have full access to libraries and get proper education. Language differences. The vast majority of people speak both English and Spanish, and it is difficult to define what language. Inability to get proper medical insurance for all residents in time. Nursing diagnosis. Development of organizations that aim at improving services for the community, attention to residents' demands and needs, and evaluation of the already existing schools and programs, their effects and consequences. Prioritizing diagnosis. Evaluation of environmental hazards, proper and in-time distribution of knowledge, and accessibility to different sources of information for the community are the main and the most rational ideas that may be used to improve the community's living conditions and to solve current problems. People have to be aware of dangers and challenges that are around. The medical industry has to be improved as well because many troubles influence human health, and it is crucially important to find out ways of how their conditions may be improved. Conclusion. In this paper, the evaluation of all functional health patterns is given. Each pattern has its own strong and weak sides, abnormal data, and concepts that are worth recognition. The analysis of one cluster clue shows that the Guadalupe community faces several challenges but is still able to cope with them and introduce proper improvement and services for people.